I want to welcome you all to tonight's webinar. We are live on Zoom. We had over 1,000 people register on Zoom within a matter of about 4 hours, Dr. Frye. So you're a very popular guy here. If you are joining us on Zoom or on our Facebook page, please chime in, say hello, and let us know where you are joining us from tonight. We'd appreciate it. I want to take a second to let you know who we are. First, I want to introduce you to Christine Siegel. She is the president of the National Autism Association. New president, welcome. We're so happy to have her at NAA. And the executive director of NAA, Crystal Higgins, is with us tonight. And my name is Wendy Fournier. I'm a founding board member of NAA and was the president of NAA for over 20 years. And after a pathetically failed attempt at retirement, I'm back as a board chair, and I'm very happy to be joining these incredible women who are leading NAA into the future in presenting an ongoing series of impactful and meaningful and especially hopeful content for all of us. Before Dr. Frye begins his presentation for you tonight, I would like to give you just a snippet of his extensive bio and contributions that he's made to our loved ones with autism. Dr. Frye is a Harvard-trained child neurologist with expertise in neurodevelopmental and neurometabolic disorders. He received an MD and PhD in physiology and biophysics from Georgetown University, completed a residency in pediatrics at the University of Miami, residence in child neurology and fellowship in behavioral neurology and learning disabilities at Harvard University, Children's Hospital in Boston, and fellowship in psychology at Boston University. He also received a master's in biomedical science and biostatistics at Drexel University. He holds board certifications in pediatrics and in neurology with special competence in child neurology. Dr. Frye is a national leader in autism spectrum disorder research, particularly in metabolic disorders, and he's authored over 300 publications. He's the president and chief scientific officer of the Autism Discovery Treatment Foundation, chief medical officer of the Neurological Health Foundation, the director of research and neurologist at the Rosnell Medical Center. Recently, Dr. Frye has launched Elatala Enterprises Incorporated, a therapeutics and diagnostics company to fill the gaps in care of children with neurodevelopmental disorders. He's led several clinical studies on children with ASD, including studies focusing on defining the clinical, behavioral, cognitive, genetic, and metabolic characteristics of children with ASD and mitochondrial disease, and several clinical trials demonstrating the efficacy of safe and novel treatments that target underlying physiological abnormalities in children with ASD. That's just a little bit about Dr. Frye. The contributions that he has made to our community over the last couple of decades are massive. And that is why when Leucovorin came up in the news back in November, we knew that Dr. Frye was the guy we wanted to reach out to because people have a lot of questions about this. So, Dr. Frye, I'm going to turn this over to you, and we appreciate your time so much and your expertise. Thank you very much for joining us tonight.
My pleasure to join you guys. Thanks for reaching out and wanting to know more about leucovorin. It's really great. I've been working on this. Myself. With Dan Rosenyo, we've been working on this now for almost 20 years. I'll talk a little bit about it, but yeah, when we published our first paper on this back in 2012, we thought everybody would be prescribing it the next year. But, it's been a long time coming and because it's such an incredible therapeutic treatment for kids with autism. So, yeah, thanks for inviting me. And hopefully I can give you some information on it and it can help, more kids. So, just my disclaimer, is, definitely remember this is still not an FDA approved treatment, for autism. There's a lot of confusion. It was definitely presented as, oh, the FDA is going to approve this tomorrow, but that is not what happened. The FDA finally did approve leucovorin for cerebral folate deficiency, and that is not autism, although a lot of children with autism do have cerebral folate deficiency. It does require a lumbar puncture, and that's somewhat invasive, and that's where I started, using it. And we know that the number of children that we have, that's not practical to do lumbar punctures and all of them. So we need to get it approved for autism, but it isn't yet, and we want to move towards that. Thanks for talking about my many different roles, and I just have my disclosure statement here, but I'll tell you a bit about some of the efforts that we've made to try and move this all forward. I was in academia for a long time, but about 3 years ago, I left to join Dr. Rosignol and head up the Phoenix office here for the Rosignol Medical Center. We started for our research and to keep promoting autism research. We started the Autism Discovery and Treatment Foundation to really continue the research. Since then, we've, since leucovorin has started to really people know about it, and the fact is that still a lot of doctors don't know about it. So earlier this year, I started the metabolic learning resource to try and educate doctors with webinars and online information for more of the treatments that will be helpful for kids with autism. And then since as we'll talk about, there is such an incredible unmet need on actually obtaining a good form of leucovorin. We've started Elitalia Enterprises, which is founded to really develop forms of leucovorin and other therapeutics for kids with autism that are made just for them, because we know the products that we have now are not optimal, for our children. So so what is this all about? A leucovorin, and what does this all mean? Well, leucovorin is a form of folate, which is vitamin B9. It's a B vitamin. And vitamins are important. I think they're really very much underappreciated. They're the keys that make our body work. And folate is extremely important. It is important for DNA synthesis, and that's really important when you have dividing cells, such as when you're a little baby growing. It's important for the brain. It's important for neurotransmitter production, which makes our brain work, and for myelination, which coats the wires of our brain to make it work. And then it's very much important for methylation, which turns our genes on and off. So it's very key to many parts of our body. Now, so it's great. We've known about folate deficiency for over a century, but what we've really discovered recently is that sometimes you can have problems getting folate into the brain. So the brain is a protected area of the body, and everything that goes in there is very well regulated. So you have to have these carriers to carry all your vitamins and everything else into the brain. And if they don't work, you don't get the key nutrients that you need. And so we know folate has to be transported in a very special way by this thing called the folate receptor alpha, which is right here. And so we have this folate receptor alpha in the blood, on one side of what we call the blood-brain barrier. And it hangs onto folate, it grabs onto folate, and it actively pulls folate into the brain. And we have a little mitochondria here, the powerhouse of the cell, to show that it's not just a passive process. The levels of folate in the brain are 2 to 3 times higher than they are in the blood. And that also tells you how important it is to the brain. So the folate receptor alpha actually has to pull folate into the brain. And as I said, it's very important. Folate is very important for growing cells. So it's very important for our little babies, as they grow and their brains develop. And here's another picture of how this kind of works. In our brain, in a certain part of the brain, kind of the center there's something called the choroid plexus. So it's a small part of our brain. This doesn't happen anywhere. It happens in one little part of our brain called the choroid plexus. And in this area, you have one side of it exposed to the blood, And you have these very important cells that do all the work, where they take this folate receptor alpha and they pull it into the brain and they dump it into what we call the cerebral spinal fluid of the brain to let the brain use folate. And then it has to be transported up into the neurons for the neurons to be able to work. Um, Folate is very important. We know that there can be steps in many different ways that we can have problems getting folate into the body. First, for folate, we usually taking it orally, and just for it to get from the intestine into our blood, we have several different carriers that carry it across the blood gut barrier to bring it into our body, and then our liver processes it, and then most of it gets transported as 5-methyl tetrahydrofolate, and it is taken up into the brain, which we see here by this thing called the folate receptor alpha that pulls it across. So what happens if that doesn't work? Well, the good thing is we have this backup system called the reduced folate carrier, which we'll talk about in a bit, which is a backup system, but it doesn't work the same as the folate receptor alpha. So, really important is folate receptor alpha. Now, there's this other key point too that we don't talk about all that much, which is very, very, very important, and is that these same transporters we see here that bring folate into the brain are also the exact same transporters that we have on the placenta. So the same mechanisms that bring folate into the brain actually bring folate to the baby while the baby is growing. And it ends up, one of the things we are finding is that many mothers of children with autism have these same blockages. And so there may be actually a problem prenatally getting folate to the baby through the exact same mechanisms. So, when did we really learn about this? So, the idea that folate wasn't getting into the brain was discovered in the turn of the century by really Dr. Rainmakers. He's a child neurologist from Belgium who was working in Germany at that time, and he had found that there were some kids that came to see him, and they weren't developing very well. And he investigated and couldn't figure it out. So he did something called a lumbar puncture, where we check the chemistry of that cerebral spinal fluid, that fluid that surrounds the brain, to see if there's something wrong with it. And he teamed up with Dr. Blau, um, who's very famous. He's in Zurich, and he's a very famous scientist who is the world's leading expert of the chemistry of cerebral spinal fluid. And they had analyzed it, and they found that some of these kids, the folate level was low for some reason. They didn't know why. And so they published their first findings of the first 20 kids that all had pretty severe neurologic symptoms. Some of them had neurologic deficits that looked like cerebral palsy, epilepsy, low functioning autism. Some of them had neurodevelopmental regression that at about somewhat a little bit before a year old, they stopped developing. They had developed some movement disorders. And so this was somewhat very severe disorder. And so at first they didn't know why. Of course, everything's genetic. So Dr. Rainmakers knew that the folate receptor alpha was really important. So he sequenced the genome of all of these kids to look for areas in the gene that codes for the folate receptor alpha. And he found there was no real problems there. So what did he do next? Well, then he teamed up with Dr. Edward Quatros, and Dr. Ed Quatros is at SUNY Downstate. And very interestingly, Dr. Edward Quatros had discovered that there is this antibody in the blood of some people. So antibodies usually attack, viruses and bacteria to protect us, but sometimes you can have autoantibodies. You have antibodies against yourself. And so Dr. Quatros found that there were these antibodies in some people to this folate receptor alpha. And so interestingly, he started out in women's health. He actually found this in women that had subfertility or had children with neurotube defects, another disorder where folate doesn't get to the baby. But he wasn't making all that much traction actually there. So he teamed up with Dr. Rainmakers and said, well, what about these kids with cerebral folate deficiency? maybe they have these antibodies too. And so they found that that was actually the case. And this was the first major paper in the New England Journal of Medicine, so probably the best medical journal there is, describing this brand new syndrome. And they had found that some of these kids, very young, at about a year old, had developed insomnia, irritability, decreasing head growth. So their heads were not growing, and that happens because the brain isn't growing. They had neurodevelopmental delays, some of them regression. They lost skills. They had what we call ascending pyramidal tract signs, which essentially is like cerebral palsy with spasticity, movement disorders, epilepsy, and seizures. And some of them, if they weren't treated, would develop visual disturbances and hearing loss. And so they measured went to see if these kids had this folate receptor alpha autoantibody. And they found that indeed, that the great majority of the kids did have this antibody. And when they looked at the titers, they were much higher than control subjects. And none of them had any genetic abnormalities in the folate transporter. So Dr. Quatros had discovered that there were these two different antibodies, one called a blocking antibody and one called a binding antibody. And this blocking antibody bound onto this folate receptor alpha and stopped folate from binding to it. So it completely blocked the ability of folate to bind onto the folate receptor alpha. Whereas the binding antibody bound to this folate receptor alpha and messed up the way it worked. So luckily, as I had said, there's this thing called the reduced folate carrier. And you can see that the reduced folate carrier here is much smaller than the folate receptor alpha in the diagram. And there's a reason for that. One of it is it doesn't like folate as much. So you have to really coax it to work. And second of all, it's just like a tube. It doesn't actively transport folate into the brain. It's just kind of like a tube for folate to get into the brain. So you can kind of think of it as the folate receptor alpha being a fire hose to bring folate into the brain, and the reduced folate carrier being more like a straw that we got to push folate through to get into the brain. So several studies were done to show that actually these antibodies did correlate with levels of folate in the brain. So one study by Dr. Rainmakers showed that the higher the titer of the blocking autoantibody, the lower the level of folate. And in our study with autism, which we'll talk about in a bit, we found something similar, but we found autism was a little bit different. We found autism was a little bit different. We definitely found this correlation of the higher the blocking antibody, the lower the folate levels. But the kids that we found that had autism, their folate levels, even though they correlated, were not below the lower limit of normal. They were low, but they weren't all the way below normal. And we think this is really key to autism, and it's a key to, in a lot of ways, it's not just folate, but other treatments with autism, that because of the way that the body works in kids with autism, they need more folate. So actually, this normal range of folate in the CSF is normal for normal individuals. It's not normal for children with autism. We like to say that normal values are for normal people. And we believe there's a combination in autism of there's this antibody that's preventing folate from getting into the brain or lowering how much folate gets into the brain, combined with a need for higher folate in the brain of kids with autism. So there's also some kids with autism have a double whammy because, as I had mentioned, the folate is brought into the brain and it's pulled into the brain. Well, that takes a lot of energy. And energy comes from the mitochondria. And the mitochondria, we know that 5% of kids with autism have mitochondrial disease, and actually 30 to 50% of them have mitochondrial dysfunction. So many times, kids with autism can have a double. They can have a problem of having the folate receptor alpha antibody, and then they can also have mitochondrial dysfunction, making the folate receptor alpha not work as well. So again, how do we fix this? How do we fix this? Well, we have something called leucovorin. So leucovorin is, as I had mentioned, is a special form of folate of vitamin B9. And one of the reasons why we use leucovorin, because a lot of people will ask, why don't we use other types of, folates, is leucovorin has been around uh, for, for almost 80 years. We've used leucovorin for the treatment of patients with cancer to rescue their body from the ill side effects of chemotherapy. So we have been using leucovorin for 80 years, so we know a lot about it. And we know that it's a very, very, very safe and effective form of folate. So when you hear people talk about the fact that we just don't know that much about leucovorin and its treatment, we've been using it for 80 years. So that's quite some time. So what we do know is that leucovorin can get into the brain through the reduced folate carrier. So this is something that we've known by treating individuals with cancer. So we also know how much we have to give and how it gets into the brain. So it's a very useful form of folate. And as I mentioned, to fix this, we have to push folate through the reduced folate carrier. This is kind of like a straw. So what we actually have to do, since folate isn't being pulled into the brain, we have to increase levels of folate in the blood and actually push the folate into the brain through this little straw to get it to resolve the problems that it has. So one thing we want to talk about that's very, very, very important is leucovorin and other types of what we call reduced folates is very different from folic acid. So folic acid does not occur in nature. Folic acid is a synthetic form of folate that we made, which is very stable. So we can use it for long periods of time. It's very stable and it's inexpensive. And one of the great things about folic acid is we can fortify our foods with it as a type of folate because it's very stable for a long period of time and it's cheap to put in foods. However, there is an issue with folic acid. It's great for, let's say, everyday supplementation. But what it isn't good at is it isn't good at treating anybody that needs more folate. And so why is that? Well, folic acid, since it's synthetic, does not go into the body and the body cannot use it automatically. The body has to activate folic acid through something called dihydrofolate reductase. So that's what we call an enzyme, or you can think of it as a little machine that activates folic acid. The problem is that our body can only activate about 400 micrograms or zero point 0.4 milligrams of folic acid per day. So that means if you have higher folate requirements, you can't get that with folic acid. You can only, at the maximum, get zero point 0.4 milligrams of folate, active folate, from taking folic acid. So we have to use folates that go right into the folate cycle and are ready to use by our body. And so that's where folinic acid or leucovorin comes in. And we've been really trying to use its really formal title, leucovorin, for a number of reasons. And one reason is because folinic acid sounds so much like folic acid. A lot of people that don't know the difference confuse the two. So we have to remember folic acid we cannot use to treat a disorder of folate metabolism. So going back to kind of the science and where things were when this was cerebral folate deficiency was discovered, and we had mentioned that Dr. Rainmakers and Dr. Quatros really wrote this great paper in the New England Journal of Medicine about these kids with cerebral folate deficiency. And they had mentioned that some of them had symptoms that were like autism. And then after that, as people started to learn about it, they actually found that there were other cases of kids with autism who had cerebral folate deficiency. And most of these kids were pretty severe, very low functioning kids with autism. At that time, I was, a child neurologist just starting out. And I started seeing kids with autism, and I noticed many of them, didn't respond to any treatments. And working at a big hospital at that time, we could do lumbar punctures to see if there was any problems. And we did. And I started finding out that some of these kids actually had cerebral folate deficiency. And when you treated them with leucovorin, they responded quite impressively. So, with doing that, of course, I teamed up with my colleague, Dr. Rosignol, and we said, how many of these kids are running around our autism clinic? And it's kind of hard to do a lumbar puncture on all of them, but we have this antibody we can test, this folate receptor alpha autoantibody that Dr. Quatros discovered. Can we test them to see, maybe if they have this antibody and see if they're candidates for this treatment? And what we did is that's exactly what we did. And when we found at first, we would use this test, the folate receptor alpha autoantibody, to see which kids may have cerebral folate deficiency. And then we would do a lumbar puncture to try and confirm that. But after a while, after we found out how safe and effective leucovorin was, we gave parents a choice. Would you like a lumbar puncture, or would you like to just maybe try leucovorin to see if it works, since it's pretty safe? And if it doesn't work, you could stop it, no harm done. And so what we did is we started to find kids in our clinic that were positive for the folate receptor alpha autoantibodies, and we offered them treatment. And we then looked at how their symptoms changed over about 12 weeks or so. And when they came back for their follow-up appointment, we asked them, and we had them fill out a structured survey of if things got better or worse. And we compared them to something called a waitlist control group of kids that had gotten the test, but were waiting for the results and hadn't made any other changes in their treatment. And that's where we noticed that kids had made some significant improvements, which we'll talk about in a second. So first, we asked the first question: how many kids may have this antibody? We asked, well, the kids coming into our clinic, is it 2%? Is it 10%? Is it 100% of kids with autism? So what we found is that of the two antibodies, from the blocking antibody, that 60% of the kids that came into our clinic had the blocking antibody, and 50% of the kids had the binding antibody. So 75% of the kids we tested had one of these two antibodies. Then, as I mentioned, we asked the parents to fill out a questionnaire that included these 9 questions of symptoms related to autism. And we simply asked them if the symptoms got better, mildly better, moderately better, and much better, or worse. And we compared it to the waitlist control group. And we found that there was significant improvements in receptive language, expressive language, verbal communication, stereotype behavior, and attention. So this is what we call an open label study. So when you have an open label study, the parents and the children and everybody know they're getting the medication. So there could be bias, right? If you're taking something new, you want it to work. So you might just be saying, well, this seemed to work. Although we suspected there was something here because many people reported improvements in the same symptoms. So the next step was to do what we call a double-blind, placebo-controlled study, where nobody knew if a child was getting the sugar pill or the leucovorin. And so we completed this in 2018, and we found that indeed that there was significant improvement in verbal communication with treatment of leucovorin. And if you were positive for the folate receptor alpha autoantibody, there was marked improvement with what we call a large effect size. So a very, very significant effect in those that took leucovorin and had the folate receptor alpha autoantibody. So, and here we can see the actual changes. So kids on the placebo, there was some improvement in verbal communication, but they were getting therapies and speech therapy and such. So there's a small change, but we can see with folinic acid or high-dose leucovorin, there was really a very significant change in verbal communication over 12 weeks. And we can see that the ones that were positive for the folate receptor alpha autoantibodies had what we call a large effect size of 0.91, but we also found something called the number needed to treat. And so that's how many kids you need to treat in order to get one effect. And so many times, I say many people think that, when you get prescribed a drug, the number needed to treat should be one, right? You go to the doctor, they give you a drug, and it should work, right? Number needed to treat should be one. But in most clinical trials, the number needed to treat, people will be surprised, there's somewhere around a 4 or 6 that you have to treat 4 to 6 people to get the effect. So we found that we only had to treat 1.8 children to get an effect, which is an impressive effect size. So then after this study, we went on to actually do work on a new type of leucovorin. And during that time, though, 4 other groups around the world took our results and they verified. They did studies using leucovorin, controlled studies. So in France, Iran, India, and China, they used slightly different doses and slightly different outcome measures. But the important thing is that all of them were positive studies. And there's a lot of criticism that the studies that have been done so far are very what we call heterogeneous. They're very different. So can you compare them? Can you combine them? And usually we use that argument when things don't work out to explain why things don't work out. But here we find that all of the studies were positive. And so this kind of means that, you can change the dose a little, you can look at different outcome measure, and it all comes out positive. So it's very, very promising. We also we were able to equate because some kids again were getting speech therapy and no treatment, and of course the kids we were treating were getting speech therapy. So we were able to equate the effect of speech therapy on and to the effect of leucovorin. And so what we found is that pretty much 3 months of leucovorin treatment was equal to 177 hours of speech therapy, which would be, as you probably know, it'd be hard to get that in a year. And we also found that it wasn't just improvement in expressive language in kids that didn't have any language. Even kids that had language, we had improvement in speech and understanding. Other studies have looked at whether in treating cerebral folate deficiency improves many of the biochemical changes in the brain, and they found that it actually does, which is another good sign. So then we recently, since there's several different studies that have been done to look at that cerebral folate deficiency and autism, we asked, okay, what is the prevalence if we look at all these studies and we combine them all in what we call meta-analysis to get some information. And so we found that we looked at the prevalence of what we call cerebral folate deficiency, which we talked about in autism. What is the prevalence of that? Because people talk about cerebral folate deficiency and they say it's a very rare disorder. Well, the studies really bear out that about 44% of children with autism probably have cerebral folate deficiency. And this actually, if you look at the numbers in our study and the number of children that responded, very significantly to leucovorin, these numbers are completely consistent with that. And then we looked at what the etiology was, why they had the cerebral folate deficiency. And we found that 83% of the time is because they had antibodies to the folate receptor alpha. About 43% of the time, they had mitochondrial dysfunction, and about 14% of the time, they had genetic abnormalities. We also looked at kids with cerebral folate deficiency with and without uh, autism spectrum disorder. And we'll talk about the ones with autism spectrum disorder. Those children with cerebral folate deficiency and autism spectrum disorder, we looked at how many of them responded to leucovorin and what symptoms responding. So we found that kids with autism, 67% of them, so about 2/3, had significant improvements in their autism symptoms. About 58% improvements in irritability. 88% in ataxia, unsteadiness. 76% had improvements in their neurologic pyramidal signs. So that's spasticity and other signs that are kind of like cerebral uh, cerebral palsy. About 50% of them had improvement in their movement disorder. And very interestingly, 75% of the kids with children with autism and cerebral folate deficiency who had epilepsy, 75% of them had improvements in their epilepsy. So not, they were probably on, I'm sure they were on anti-epileptic medications, but giving leucovorin, treating them with leucovorin for their epilepsy, 75% of them had improvements in their seizures. Other impressive data. This is a study that shows that kids that these are kids that had the mutation in the folate receptor alpha. That these kids had very significant abnormalities in their MRI. And if you looked at them, you probably say, oh, this is something that's not reversible. So treatment of these kids with leucovorin improved their MRIs. So their actual brain started growing and healing with leucovorin. So one of the other things that we've really kind of looked at is that this isn't just autism. That it seems that depending on when cerebral folate deficiency manifests, you can have many different symptoms. So the original cases of cerebral folate deficiency, we saw these developmental regression, what seemed like new onset cerebral palsy. And the kids that we work with much have this onset of autism spectrum disorder. So we believe that when cerebral folate deficiency seems to become significant at 2 to 3 years old, it may look like autism. And we found recently with our colleagues that do PANS and PANDAS that actually many of the kids with PANS and PANDAS, we found that 60% of them have the folate receptor alpha autoantibodies and may respond to leucovorin. So in adolescence, it may look like PANS PANDAS, sudden onset of obsessive compulsive symptoms, tics, self-interest behavior. Then interestingly, Dr. Rainmakers found that adolescents and young adults who had new onset schizophrenia, which was refractory to treatment, had cerebral folate deficiency. And then another doctor, Dr. Lisa Pan in Pittsburgh, found that she found adults with treatment-resistant major depressive disorder, particularly with suicidal ideations, had cerebral folate deficiency, and treatment with leucovorin improved the suicidal ideations and their depression. And there's other studies now that show that the cerebral folate deficiency is associated with multiple sclerosis and dementia, Parkinson's disease, and other diseases of later adulthood. So what we see is that there's really expanding spectrum of this and possibly a great treatment. So then people ask, okay, well, how can you be sure, you're making a diagnosis of cerebral folate deficiency? You really need an LP. And of course, as I mentioned, a lot of people don't want to go through an LP. So what can we do about that? So what we've done is we've defined it so that if you have an LP, you can definitely say you have a definite diagnosis of cerebral folate deficiency. But like other disorders, there's other disorders like this where you don't have all the information, can't be exactly positive. So you can say that if you have the antibody and you have symptoms consistent with cerebral folate deficiency and you respond to leucovorin, we can say that you probably have it. So we don't want to say you definitely have it, but we can say we're pretty sure that you do. And then we can actually rate our confidence in the diagnosis. So, we don't have criticized by saying that we're diagnosing the definite cerebral folate deficiency if we don't have that, but we can treat patients. We think that it's important to treat patients if we think that they probably have cerebral folate deficiency. Of course, we're working on biomarkers. So one of the things that we're doing is trying to expand the significance of these biomarkers. One of the things that we found recently is that the binding folate receptor alpha autoantibody, the titer of it, how high it is, actually predicts the response. So the improvement in autism symptoms. You can see this in this graph here. This goes down because the symptoms reduce with the higher titers. And then we really recognize the significance of another biomarker called the soluble folate receptor protein, which we kind of had ignored for a while. And we find that this actually seems to not only cause severe symptoms, but also require higher amounts of leucovorin. Milk is for babies, and cow's milk is for baby cows. We know that that milk actually will increase the titer of the folate receptor alpha autoantibody, and so it should be avoided. Another issue that we've come into is the formulations, and this is very important. We have found that the commercial formulations of leucovorin have lots of what we call incipients in them, lots of additives, and that many children react to these additives. They can have worsening behavior, and sometimes it just negates the effect of leucovorin. So right now we only use compounded formulas, and we have favorite, compounding pharmacies who we trust, around the country. And we also did that to avoid the shortages because we've had many shortages of the commercial brands. But now it's being used so much that many of these compounding pharmacies actually are running out of leucovorin. We know that it's not always that simple. I like to say that leucovorin is not the autism pill. There's many other things that need to help folate work, including B12. B12 is extremely important and works for folate in this folate and methylation cycle. We sometimes have to wait some time to actually see an effect. I know that many people have seen these stories in the news where in 1 week a child starts talking. This does not happen all the time or even most of the time. Sometimes it's really kind of a very slow uphill improvement, but there's always an improvement. Sometimes we know we have to add, things like B12 or carnitine or vitamin D. Normally, when you start leucovorin, many children, about 20%, you'll see hyperactivity. You see this in most B vitamins. This usually resolves in somewhere 6 to 9 weeks, usually shorter than that. We like to step it up or slowly increase that to prevent that. And so this is something that needs to be used over time and needs to be adjusted. We know that, as I had mentioned, that mitochondrial dysfunction and disease affects many children. So many times you have to add mitochondrial cocktail, carnitine, ubiquinol, or CoQ10 to help leucovorin work. And then, there's really this other important aspect of all of this, which we really is so very important. And that's the cost, really. The cost of autism at this time is going to bankrupt this country. Right now, it's the lifetime cost for to care for a child with autism probably well exceeds $5.4 million. And so that's somebody, not only does it cost that, but they're not somebody that can earn money to actually care for themselves. And it differs with those that have or do not have intellectual disability. Those with autism with intellectual disability, it can cost $10 million or more to take care of a child. So if we add up the numbers, the total numbers to the cost, when we look at with autism, is $27 trillion. It's a number that's just outrageous, and autism is growing each day. So this number grows by $1.6 billion each day. So I think we need to, when we think about things and where we're going to go, we have to think about this, and how we spend our money, because the research and cures for autism are not being funded. And we can think about this. I kind of think about this as I'm a researcher in research grants. There aren't research grants that they're giving out to look for, you know, treatments for autism. So it's very hard to get a grant because they want data that shows that this is absolutely going to work. But if you think about it, a research grant, a 5-year research grant, is probably about $5 million. So if you could give somebody a research grant or do something, not even a research grant, do some type of program that's going to help individuals with autism for $5 million, if that would just help one individual, it would pay for itself. So you have to think about that. Just curing or just helping one child with autism would save $5 million. We could spend $5 million to do that. We know that we could do it for a lot cheaper than that, but we have to spend our money wisely because we're losing it. How much does leucovorin cost? So right now, it costs about $28 a day for a prescription. So that's about $10,000 annually. So when you think that the average cost of taking care of a child for a year with autism is about $100,000, if you could decrease the amount of therapies that they have, you could take that number, $10,000 could decrease the amount of money that you spend, um, on caring for individuals with autism. And I hate to talk about money, but it's a reality. It's our children that not only are they not being treated, but we're going to bankrupt ourselves by not treating them. So some of our solutions, the way we look at it, there's a lot of hurdles, especially with leucovorin. There's doctors that don't believe in it, that aren't educated in this treatment. There's the availability, and we're seeing this right now. It's out of stock. There's these formulations that are not made for children with autism. There's insurance hurdles. Even when you can get it, insurance won't pay for it. And there's the tolerance to and the forms. Right now, really, we have these pills which are not optimal for children to take. So, and many parents are turning, because they have no other choice, to over-the-counter forms that are not FDA approved drugs. And one of the problems with supplements, some of them are really great, but some of them aren't. And they're not regulated. It doesn't mean that they're great today, that they're going to be great tomorrow. So we really need, a form of leucovorin and other medications, not just leucovorin, other treatments that are made just for children and made just for them. And so we know that we need to reverse the trend. We have a trend that keeps going up and up and up, and we got to bring it down. We have to bring it the other way down. And we already know about treatments that are effective, like leucovorin, that aren't being implemented. They need to be implemented. We know that we have treatments, but they're not well tolerated, and we have to figure out why. And we have to discover new treatments. There's many treatments in there. We have to treat those medical abnormalities that cause a lot of the symptoms and make autism worse. And we have to educate physicians. So, we're trying to do our part. As I had mentioned, we started the Autism Discovery and Treatment Foundation earlier this year. Well, not this year, last year. We developed something called the Autism Discovery Coalition, which is a coalition of scientists and other stakeholders to try and educate um, our NIH and our legislators in what we need to do, and our metabolic learning resource to try and educate physicians, and finally, our company to try and make treatments that are made just for kids with autism so that they have the treatments that they should. Lots of this, if you want to learn more, I wrote a book about a year ago that came out called The Folate Fix. And the great thing about it is that it has 12 stories of families that searched for this treatment and found it. And the stories are great because, it tells the struggles that they went through really to find the treatment and cure their kids. So with that, I thank you for your attention and be happy to answer any questions.
We have billions of them. Thank you so much, Dr. Fry. That was such a wonderful presentation, really informative. My first question is kind of where you left off. You were talking about affordability and the investment that needs to be made. It kind of made me mad because we worked really hard back in 2006 on the Combating Autism Act that provided, I don't know, since then, maybe $2 billion in research funds, none of which has helped our kids. It would be great if a $5 million study was funded to work on, establishing leucovorin as a treatment for our kids. I'd love to see that happen, and I'm very hopeful that NIH will make that possible in this climate that we're in at the moment. I wanted to ask you because we're getting a lot of questions about the doctors not being educated, not wanting to prescribe Leucovorin. They don't really understand it. Are there any resources out there with autism discovery and treatment or anywhere else that you can recommend where parents can grab some resources that they can provide to their doctors?
Yeah. Well, on our website, so you can come to the Autism Discovery and Treatment Foundation, and we have actually a page that we're making just for leucovorin resources.
Okay.
We're listing all of those compounding pharmacies that you saw there, so you know where you can get that. And we're building it, so we intend to have resources for doctors and parents.
Okay.
The website also, we have all the research that's been done. So also you can go to our company Alitalia. Also, we have resources there about leucovorin. Lots of papers that are that you can download that you can give to your doctor to try and educate them. We also wrote, I think we have that on there. We put a press release together to kind of summarize, where things are and try and dispel some of the misinformation,
Mhm.
that's out there. Some people think that the fight is over. It's already approved for autism. Well, we know that's not the case. Then you have people that won't refuse it, will refuse to prescribe it, right? Because they hear
Right.
this rhetoric that is just completely inaccurate. I love that one that we just don't know the safety of this drug.
Right.
80
And
years,
this is an 80-year-old drug. Yes.
80, 80-year-old folate drug, something that we know has such incredible safety,
Yeah.
So there aren't enough studies. There aren't enough studies. There just aren't enough studies. There are 253 children that have been through controlled studies, which is more than the number of children that were used to gain approval for Respiridol for autism.
Which has all kinds of crazy side effects as opposed to something like leucovorin.
The studies are so different. Yeah, they're all
Mhm.
positive. So it
Yeah.
shows no way where you slice it, it works. So there's just all of these there's really myths out there, and I don't know if people don't want to learn or they just want to listen, to who their favorite person is. And then of course there's the messenger. People don't like where the message came from, unfortunately. And I think that it doesn't really matter. It's really a promising thing, and I think it's just good that from my standpoint, I don't want to get political at all, but I think that for somebody in power to say that autism is treatable, don't even don't even talk about leucovorin, but to say that autism is a treatable disorder is a major, major, major step forward.
It is huge, and that's actually a big part of why I stepped back into the autism world after trying to retire for a bit because it's a very exciting time right now. I want to get to some questions because we have a whole bunch right here. One that keeps coming up, Dr. Fry, is people asking about adults and is it too late if your child is already grown? Can it still help to? I love that slide, the MRI slide that you showed about repairing the brain. Talk to us about leucovorin use in adults, please, with autism.
Yeah, I mean, definitely, we know that, the earlier you treat, the better. That's, there's no doubt about that. But you never, there's never a time when it's too late. Absolutely, there's never a time when it's too late. And I can tell you lots of stories of adults, young adults, adolescents who have made major changes by by things. In fact, that's how we found. That's how I kind of discovered that the soluble folate receptor protein was significant. It was on I think a 33-year-old man who was nonverbal and
Wow.
couldn't communicate. And I realized, well, what's the downside? Maybe we could, he has this thing, we don't know what it means. Maybe he'll respond to this. And he needed high doses of leucovorin, and he actually started making progress after 33 years. You know,
That's amazing. Can we talk about dosing for a second? So, leucovorin, is a hot topic right now, but we've actually been using that in the autism community for a long time. My daughter's been on it for probably 15 years almost. But I want to talk to you about dosing because I'm seeing in the comments people are giving, like a low dose of 25 milligrams a day. How do you determine dosing typically?
so we start out. So for the first thing, of course, it's important to, leucovorin is not the autism pill,
Hmm.
when it comes to me and they're like, okay, when am I going to get my leucovorin? Say, okay, slow down, slow down. Let's take a broad look at what's going on here. So first of all, there's many different complications. Kids are very complicated. So it's important that we make sure we treat the whole individual, not just use the leucovorin. Two, of course, as I had mentioned, formulations. You have to get a good formulation to make sure it works. Some kids will respond to lower doses, and then some kids need higher doses. So what we do is we usually get up to the standard dose, which is about 25 milligrams twice a day, and we see what the response is. And then we tend to titrate up to see if there's improvements and gains with higher doses. And it ends up that, a lot of individuals need higher doses than the standard 25 milligrams twice a day. And I don't think it should be surprising because really the whole idea of 25 milligrams twice a day is for a completely different indication, right? It's for a different purpose. So, that's where some of this, research, okay, that needs to be done comes in of what is the dose for individuals with autism? What would predict what the dose is? As I said, they can have many different abnormalities. Maybe some have the antibody, maybe some have genetic changes. Maybe some have mitochondrial issues. Maybe some have GI issues. They're not absorbing it. These are all really important factors. And I like to say that's where the art of medicine comes in. The idea of, don't do this at home. You're tempted to go out there
Yeah.
and, but it's not that easy. And we really need to figure this out. And a lot has to be done to really make sure that we treat our kids optimally, not just throw something.
Yeah. Well, I'm thinking about people who are, they actually convince their doctor to give them a prescription for Leucovorin. They're trying it and they're not seeing any improvement, and then just giving up, thinking that it's not going to work. So I guess that's just something you have to work on. Hopefully, you have a good doctor and somebody like you who can help you out with that. When you were talking about casein and milk, the audio had cut out for a second, and we had some questions about that. Because some people are saying they thought they were under the impression you could not have any dairy at all. So, can you please clarify that slide?
So, I mean, it's a whole different discussion about, dairy and milk and all of these different things. So, you know, our bodies, first thing we have to realize is that our bodies are not made to drink milk. Our bodies are made to drink milk as infants, right? So, a lot of people, might try and wonder, why is everybody so lactose intolerant when they drank their mother's milk? And that's because our body at about 2 to 3 years old turns off lactase. So we don't drink milk, you know, because it's good for us as a baby, but it's not good for us as a child or an adult, and so why is that? And how does it differ from other dairy? Right.
Okay.
Do we mean milk or other dairy? So what is it about milk? Well, one, we know about, lactose, and lactose intolerance, right? That we can't tolerate that. But the other thing is that milk has not just casein, but it has all these other proteins in it, which are really important for the infant. So there's many proteins in milk that protect the infant from infections, that carry folate, carry iron to the gut. because an infant really doesn't have a very well developed immune system.
Right.
Okay. And so you have all these, and the things that do that are these big proteins like casein. Then you develop your immune system. So 6, 8 months old. And so you start to really develop an immune system. And most of your immune system is in your gut, to protect you from invaders. But some people, and we find this is true of kids with autism, is their immune system just tends to be overactive for some reason. And so then you say, okay, if you have an overactive immune system, what triggers the immune system? So it ends up what the immune system looks for are large proteins. Okay, that's what it
Mhm.
can sense. So when it sees large proteins that are not from itself, it starts to react. So go back to where we were. What does milk contain? Is large proteins. What does cow's milk contain? Large proteins that are foreign. They're not
Right.
from us. So our bodies start. So some people, most of us probably, but a lot of, if your immune system is a little overactive, it's going to react to these things, cause inflammation. And what we see in a lot of kids with autism is that this causes a lot of hyperactivity, irritability, because the child doesn't know why they feel unsettled, but they have, this unsettled feeling probably. I mean, and it's like a lot of people that have dairy allergies, right? You just don't feel right for some reason. But what's the difference between that and other dairy? Well, you have yogurt, and yogurt's fermented. So you have bacteria that break down the lactose, that break down the proteins.
Okay.
Okay. And even like a lot of yogurt has lactobacillus. So it has a bacteria in there that's actually going to eat the lactose, so it's going to get rid of it. It's actually going to feed on it. What about cheese? Well, cheese many times is aged, it's fermented, but also the process of making cheese actually denatures the proteins. So that's actually part of making cheese.
Okay.
Um, Process of making cheese, you actually break down those proteins. There's been studies that have looked at intact proteins versus denatured proteins, and you react much less to these denatured proteins than you do to these whole proteins. So you have much less reaction to those other types of dairy. And then, of course,
Right.
you have things like butter and cream, and that's made from the fat of the milk. And we don't react to the fat of the milk. The fat of the milk's fine. So
Okay.
butter, cream. So it's really, milk is really the a hot spot that really activates the immune system. Of course, some people do have dairy allergies, you know, and they're more sensitive, but really milk is the big culprit. And the only other thing that's dairy that's made directly from milk is ice cream, you know. But we live in a great time now where there's an $11 billion industry on making not milk milks.
Yes.
So there must be
Yes.
something to it.
My fridge is full of it. Okay. Next question is, does leucovorin need to be taken for a lifetime, or does it actually cause some reparation along the way?
Yeah, it's a great question. Most many patients that I have need to continue to take it. Yeah, yeah.
Okay.
And so I have had patients that are on it for since I see, you know, I saw a patient this last week. That was one of my first patients when I was in Texas. Almost 20 years on Leucovorin. And but some children we have had some successes. Now, it used to be that patients would come to us, we'd see 7, 8-year-old kids that, have been all three therapies, the things didn't work. What can you do for me, doctor? But now, parents are being more proactive. I mean, that's one of the great things about this message. You're getting, 3-year-olds, 2-year-olds, 3-year-olds in there that are being treated. And we have some had that have actually made some full recoveries, and we've retested them and they've become antibody negative. And
Wow.
it's possible they come off of, leucovorin. So, yeah, I think it's definitely possible. But the great thing about it is that folates are so well tolerated, that there's little downside. And there's a lot of research that have tried to find out because we do put folate in our food. Are there any side effects of long-term folate? And it's really hard to find any downside to taking folate long term. And it's a B vitamin. And the important things about B vitamins, why they tend to be non toxic, is because they're water soluble. We pee them out at the end of the day, what we
Yep.
don't use. And so we say the worst you can do is make expensive pee.
Yeah, very expensive fee. Okay. Are there any common medications used in the autism community that it might interfere with in a negative way?
Not many. But of course, there's medications, the medications that it interferes with many times are used for autoinflammatory disorders, cancer treatments, and such. And if anybody has any type of serious, if they're on any type of serious drugs that like that, they need to talk to their doctor. I mean, that's a whole different, a conversation. But in general, it reacts positively with other drugs. Many, for example, anti-epileptic medications, their side effects tend to be by blocking the folate pathway. So it actually helps with some of those.
Okay. Can you get a FRAT test without a functional doctor? Does it show false negatives and positives? Can you talk about the FRAT test for a sec?
I mean, the FRAT test is a very interesting test, and we really have to take it for what it is. It's one piece, of the puzzle. So, one of the things that we're looking at, as I had quite mentioned, that many children with autism, their mothers are positive for the folate autoantibody, and what we're actually finding is that it seems to run in families you know? So the big question is, well, if everybody has a folate autoantibody in the family, why does maybe one kid have autism, right?
Yeah.
Uh, and so we have to make sure that we look at it in the larger context, that it's one piece of the puzzle that we found, and there's probably many other pieces. So is it false positive, false negatives? I don't know that we can think of it that way, because when you think of it that way, and I think that's a problem of the way we look at medicine right now as an absolute, and it's not an absolute. It's one piece of the puzzle that helps you, that guides you
Yeah.
um, to the treatment. And sure, there may be other reasons, and there might be other problems that the folate isn't going to fix. So I think it's important to as a guide, but
Okay.
it's not an absolute. And any doctor can order a FRAT test. Yeah.
If you can convince them to some doctor, well, you know what? As autism moms, we're pretty pushy, so we might be able to get that to happen. Don't give up,
So
people.
warning though is that there's now a lot of false FRAT tests out there because
Are there specific labs that you would recommend?
well, there's only one lab. So Reliagen is the only lab that does the FRAT
Okay.
test. There's only one FRAT test, but
Okay.
there's services that are popping up saying, "Oh, we can do your FRAT test and have a turnaround in 2 days." And we know that's impossible because we know to do it right, you have to go through a whole process, of treating the sample and such. And so it'd be impossible to do that. So we find that there's a lot of labs that buy kind of products off the shelf that are more research based,
Okay.
and then they just say, "Oh, I have a frat test," and the numbers are meaningless.
Okay. All right. Need to let everybody know because we've been asked so many times about Dr. Frye's slides. We do have a PDF of those slides already on our website. Thank you so much for giving us those. We appreciate it. So you can go to nationalautism.org and you can download those slides if you want to take a closer look. And also, we will have this recording on our website within the next few days. And you can also watch a replay of it on Facebook if you would like to go and listen again. And then one last question. The name of the lab that's doing the FRAT test, is it Religion?
Religion, yeah, I'm sorry. Religion. You can go to so if you go to fratnow.com, FRAT
Okay.
now.com, and it has all the information there. Yeah.
All right. And in the meantime, I want to ask everybody that has attended tonight, would you please let us know what you would like to hear about in future webinars? I love talking about treatment. This is my favorite thing to do. I love it. We're not talking about curing autism. There's no cure for autism, but man, we got to cure those underlying medical conditions that so many of our kids have. And if anybody has a problem with that, I don't understand it because there's nothing wrong with making our kids' bodies healthy. Okay. We're not trying to take the autism away, we're trying to make them healthy. Dr. Frye, thank you for helping to make our kids healthy. And thanks for helping us all to understand a little better about leucovorin, what it does, what it can do, and given a lot of us some serious hope here with this treatment. We appreciate it.
No, thank you.
It's always so good to see you. Thanks to everybody for attending. I hope we'll see you very soon with our next presentation. Have a great night.
Yeah. Bye bye.
Thanks, Dr. Fry.